Welcome to the Half Hour to Health. HIV/AIDS. Now, you know, it's kind of tough because if you're raised with this infectious plague that's wiping out most of the planet, that's contacted Africa, you know, we've been told this for like 20, 30 years. Now, the reason I came up with this talk is because I saw something on Discovery Channel a couple of months back. And then I started to do more research. Now, I've got several patients who have tested HIV positive, several more that tested HIV positive, then they became HIV negative. So, you know, the tests can change a lot. And I knew the tests are inaccurate. But what I saw on Discovery Channel was very, very interesting. It was clinics in Africa. Now, I can't say they're curing AIDS. But when they interview a fella that 10 years ago was carried in on a stretcher at death's door into a clinic, and he was treated at this clinic. Within a month, he's standing up, healthy, working back on the farm, and he's being interviewed 10 years ago, strong and healthy. Now, they didn't say he was cured, but in my book, no symptoms, healthy and strong from being sick, that sounds an awful lot like a cure. And I'm going to tell you exactly what they did to cure him. That would be nice to know, wouldn't it? Well, let's look at some experts. Now, first off, here's the winner of Nobel Prize Chemistry. We have not been able to discover any good reason why most of the people on Earth believe that AIDS is caused by HIV. Nobel Prize. There is simply no scientific evidence demonstrating that this is true or why doctors would prescribe a toxic drug called AZT. We cannot understand why humans would take that drug for any reason. Okay, the line is drawn here. AIDS does not exist. Now, if you look up AIDS denialism, there's a whole group of definitions and information on that. This is one of my favorite quotes. Virus mania is a social disease of highly developed society. This is where AIDS came from. To cure it will require conquering fear, fear being the most deadly contagious virus most efficiently transmitted by the media. To err is human, but to preserve the error is diabolic. First off, when did it begin? Now, AIDS first, you know, most doctors will tell you it began in the 80s. Okay, and that's kind of true, kind of not. Okay, the diagnosis of AIDS first began in the 80s, and it started with gay men in the San Francisco area. Okay, now what's interesting is they had two characteristics that were common. They were homosexual and they heavy drug addicts. Now, the drug that they were using was amyl nitrate. Now, these are called poppers. And what amyl nitrate does is it's extremely toxic to your system, causes nerve damage, but it's a nitrate. Okay, it actually weakens your immune system to an incredible amount. And this was really, really popular with this group. And in fact, they used to have a thing called GRID, which was gay-related immune deficiency. And this is before AIDS. Now, before that, before 1983, drugs, drug addicts, IV drug users had a weakened immune system syndromes, okay, and they started to try and classify it before 1983. And this went way back into the 40s. Because now, does anyone in here shoot up heroin on a regular basis? No? No? Okay, well now, if you're doing regular heroin IV drug use, do you think is that going to cause a problem with your immune system? Yes or yes? Huge. It destroys the liver, weakens the immune system, increases cancer. It starts fungal infections. So if you're any type of IV drug use, it weakens your immune system. So they knew that. It used to be called combined immune deficiency syndrome, and this was not in just the gay population, but any IV drug users, people with chronic immune system deficiencies. Severe combined immune deficiency syndrome, and this is from the book called The Great AIDS Hoax. So it's been there for a long time. Now, they changed the diagnosis because you got to figure if you got a group of people, if you can group them into a category, then you can bill for it. It's easy to treat it because, you know, even if the patient dies, you know, you're following appropriate medical protocols, so it's okay. So the whole impetus behind categorizing all of these different diseases is so that if you treat, now let's say you treat a stomach ulcer with an aspirin, okay? that person's going to bleed to death and you know, probably sue you because you're doing an inappropriate drug for the diagnosis they had. Now, let's say they're diagnosed with a heart ailment, and you give them an aspirin, and they die of a stomach ulcer. You can't be sued because you're doing the appropriate medical for the appropriate diagnosis, even though it's stupid in both cases. Okay, do you see what I mean? So now they had to come up with a grouping of these diagnoses. So in 1984, they had two diseases. There are no tests or anything to show that you got this disease. But if you had these two diseases, Kaposi sarcoma, which is a blood cancer, and pneumocystis carinii pneumonia, PCP, if you had these diseases and you were a heterosexual white businessman, you had pneumonia or a blood cancer. If you had these two diseases and were an IV drug user or a gay man in San Francisco, you were categorized as AIDS. So it wasn't just the disease, it was the disease and lifestyle factors to go along with it. Okay, do you follow that? Okay, now, okay, I'm following up here because I'm trying to not, it's hard to say AIDS doesn't exist, but I'm trying to explain where the animal came from. So now in 1987, the CDC expanded the list of AIDS indicator diseases. So in 1984, we had two diseases that indicated two diseases with your lifestyle would put you in a category of AIDS. Okay, 1987, they extended the list of diseases. So now, remember, people aren't more infected. They just included you. Okay? So it jumped by a third, 30% increase. Now, these aren't more people getting sick. We just lumped them in a different category. Okay, now, so pre-1987, the AIDS cases peaked in 1988, and they didn't really increase. Well, in 1992, we added more diseases to be lumped in that category. Anybody smell like a rat? Okay, does it sound like unusual and ridiculous? Okay, is measles going to all of a sudden cause gangrene, and gangrene all of a sudden going to cause tuberculosis? No, diseases don't work that way. Now, in 1992, okay, there were more diseases added, indicating 29 diseases. So if you had any one of 29 diseases, along with the lifestyle factors that predispose you to this, you got AIDS. Okay? Now this was huge because it also, they had people without being sick that would have AIDS. And this was a low CD4 count. Now, CD4 is part of the immune system cell. If anybody in here want to just experiment around and mess around with the medical doctors to get a low CD4 count, what you got to do to lower your CD4 count, don't eat for 8 days. And then if you happen to have lifestyle factors, you're going to have a positive AIDS test. Okay? So now this was huge. Now, also in 1992, so they expanded the list of diseases. They also listed people who weren't sick but had a different blood test. Now they're in the AIDS category. Also, they added cervical cancer to the list. So now, if anybody can remember this, since cervical cancer is now, so we're looking at heterosexual females now put in this category, that should scare everybody in America, because we all know heterosexual females. The CDC issued a press release proclaiming AIDS was now spreading fast among heterosexual women. So now you got to think of this. There's not more cases of cervical cancer. These people already had the cervical cancer. They're just lumped in this new category. Do you see how crazy that is? Okay, there are not more people getting sick. There's more people lumped in the category.
How can they do that?
How can they do that? I would be curious too, unless you wanted to sell a drug, and that's what the CDC is designed for. So now first, let's look at the experts. Okay, now we already showed a Nobel laureate. Now again, human beings are full of retroviruses because they're saying, well, the reason we can't find it and the reason there's so many different diseases is it's a retrovirus. Let's use this new term to kind of confuse science. Well, this guy doesn't get confused easy. We're full of retroviruses. We don't know if it's hundreds, thousands, or hundreds of thousands of retroviruses in the human body. We've only recently started to look at them. They've never killed anybody before. People have been living with retroviruses for millions of years. Retroviruses are not harmful or toxic to your system. Now, Yale University, there doesn't seem to exist even a single proper definition